recording. And just FYI, we are recording this meeting. This is the monthly office hour session for HRSN service providers. If you are an HRSN service provider, you are in the right place. If you want to listen in and aren't quite yet a service provider, you are also welcome in this space. Next slide, please. All right, a few Zoom tips. So we are going to be using the Q&A function. The Q&A function. So if you haven't used the Q&A function, it should be at the bottom of your screen. Sometimes you have to click the little 3-dot ellipses that says more, and it might show up there. We encourage you to put your Q&A in, or your questions in the Q&A box, because that helps our small team navigate all the questions a little easier. As I mentioned, the session is being recorded and we'll share it after the presentation. You have the option for closed captioning if you would like by clicking the CC button at the bottom of the screen. And then, remnants of when we had live interpretation. But I do want to call out that if you need live interpretation, we are doing that by request. So if that is something that would help you get the most out of the session, please let us know and we can provide live interpretation. Next slide, please. All right, and today's agenda, not too much in the way of updates today. We'll spend the majority of our time with our office hours session, where you'll be able to ask your questions and get some answers. And then we'll wrap things up with learning opportunities. All right, one quick update for y'all today, and I will hand this off to my colleague Sarah to share an update. Next slide, please.
Good morning. It's wonderful to see you all. Thank you for being here with us today. We just want to dive in and touch on one thing that we had some feedback on regarding our last office hours. So we're talking through how to define a household, and in particular, we're trying to give examples. And one of the examples that we shared raised some space for ambiguities. Just wanted to kind of ground ourselves back in how we're defining a household for HRSN purposes. And you have here on your screen the three main OARs that we refer to. Nothing has changed. This is the same way that we've established both the eligibility determination group and the family size historically, just to kind of re-ground us again. So regarding eligibility, once a household has been defined via the eligibility determination group and the family size, they're eligible for the HRSN benefit one time during the course of this demonstration. And again, this current demonstration ends on September 30th, 2027. And then looking at how we determine the eligibility determination group, that's from OAR 410-200-0015. And it means all persons whose financial and non-financial information is considered in determining each medical applicant's eligibility. And then again, going down to what family size is. This is the number of individuals used to compare to the income standards charts for the applicable program. The one thing to keep in mind that an unborn child is part of the family size. So looking back just to how you're being defined via Medicaid and your tax filing status, we as an HRSN administrative team are not making determinations around that. I hope that helps. If there's further questions, please feel free to use the chat box or chime in. Thank you.
Thank you, Sarah. I will give it a moment in case anyone has any questions for you.
And I know I was talking very fast for it being so early in the morning, so feel free to ask clarification if needed. Yeah.
Thank you. All right. Since I don't see any questions, let me just double check. Nope, no questions. I think I can move us to the next slide. All right. And I just wanted to do a quick reminder. If you've been joining us for office hours, you've probably seen this slide several times, but I just wanted to remind folks that we are collecting member and provider stories. We encourage you to share your experience delivering HRSN services. You can use the online form that is linked on the screen, and we'll share it out after the session. And yeah, so if you have any member stories or your experience that you want to share with us, please do. There's more information directly in that form link. And then there's also a version in Spanish as well. Next slide, please. All right. And we are going to go straight into office hours. I think usually we have a few more updates, but we'll have plenty of time today for your questions. So you can go into the next slide. All right, before I open the floor to questions, I do want to share some Q&A tips. We encourage you to share space and allow others to be heard. We don't want to put limits necessarily on the number of questions you are asking, but maybe space them out a little bit so others have time to ask their questions as well. Do not share case specifics. If you do have case specifics you need help with, then you can reach out to us privately and we can work with you on that. Share ideas and suggestions. This is a great opportunity to get your input on things. If you have any feedback you want to share with us, please feel free. And we want to prioritize questions from providers and community partners. If you are not a provider or a community partner, we do definitely want to hear from you, but we do want to prioritize this space for our providers. And for submitting questions, please add your question to the Q&A box. That is at the bottom of your screen, usually, could be at the top, depending on where your navigation panel is. It'll be a little square with a question mark in it. It also might be hiding under the 3-dot ellipses button that says more. So if you need help finding that, let us know. We do ask that you put questions there. It just helps our small team navigate a lot of questions a little easier. We also invite you to ask your question out loud, but please raise your hand and we'll call on you. And what else? Just be patient with us, please. We're a small team, so if we're taking a little bit to answer your question, we might be double checking things in the background, but we are trying our best to get your question answered. With that, we can stop sharing the screen. And I'm going to navigate to my Q&A to see what questions we're going to start answering. Alrighty. What's our first question? Okay, I see there was a clarifying question from Natasha. I'll start there about the household. So it says, how can we as providers confirm who is in the Medicaid household? Does anyone on our team want to take that one? Okay, I think we're thinking in the background here. So I will come back to that one. Let me skim through questions. Sorry, I'm got a lot of questions at once and I'm reading through them. Just give me 1 second. Okay, there is a housing question that I'm going to read out. So it says, we have a housing authorized member who has received 2 months of rent. This week he came home to his rental burnt down. It is no longer habitable. Are there any provisions for this scenario where he can still use the remainder of his benefit?
Hey there. I'm sorry, Tanya. We were having some technical difficulties. I had personal ones, and then we couldn't see the questions as well. Okay, I'm going to repeat that if that's okay, Tanya, and just make sure because I was just able to pop on. Okay, we have a housing authorized member who has received 2 months of rent. This is that the one we were reading? I'm sorry. Okay. We have a
Yes.
housing authorized member who has received 2 months of rent. This week he came home to his rental burnt down. It's no longer habitable. Are there any provisions for this scenario where he can still use the remainder of his benefit? Um, Generally, well, not generally, in rule, you cannot change address and still receive the benefit. This is a very extreme situation where it's completely out of the member's control. I think that this one would be a good one to send to the HRSN program email and let us take it back and think about it. But as a rule, you're not allowed to change answers. I mean, change addresses. Apologies.
Thank you, Teresa. Right. I'm going to read through the questions again. Let's see. All right. A question about Lane County. For Lane County, have we heard if Pacific Source is approving payments in February? This might be a specific question to ask Pacific Source, but I wasn't sure if anyone had run into this. Teresa.
Actually, I'm going to lean on Leah for that one. Thank you.
Hi, yes. It's the if you are a provider with Pacific Source, they've put out some pretty um, specific instructions on how to close out for services that happen January and February. Overall, the guidance has been for providers to get that rent out for February within that kind of 10-day leniency period before the first. So that has been the guidance, but I would suggest reaching out to Pacific Source directly just to make sure the process, the workflow is being followed that they've set up.
Great. Thank you, Leah. Okay, let's see. Question about OpenCard. For OpenCard members, I recall that there were some issues that prevented providers from billing IN for outreach and engagement services until after clients were authorized for housing benefits. Is this still the case?
Hi there. Uh, no, that should not be an issue. So, outreach and engagement and billing open card should not be a problem if you are an enrolled HRSN service provider, of course, with the Oregon Health Authority. If you do encounter any problems, you can absolutely email the HRSN program email or email Accentra directly, and we can get that information to you. And I apologize, Accentra is the open card contractor that manages that, and IN is the billing provider as well. So we can get some information to you on that. But there should not be any issues with that. And thanks, Rachel from IN. That's wonderful. And thanks for commenting on that. Yeah, we will just reconfirm that there is no authorization required for HRSN outreach and engagement services. As long as they are presumed eligible and you are an HRSN service provider and you're not going over a 30-hour benefit cap, then really you are very welcome to bill. Let me know. And thanks, Kevin, and other providers as well for commenting in the chat. That's great. We do have another question coming up that is asking for provider and not OHA input as well, Tanya.
Yes, is that one that you wanted to talk about right now, Teresa? Yeah,
Sure. Yeah.
go for it.
Alexandra asked how providers are handling Spectrum mobile payments because they don't accept checks for cell phone payments. Do you have dedicated credit cards set up for HRSN? It's been challenging to set up their cards for auto pay. Um, that is from the HRSN service provider. I'll just let you know, we have talked a little bit about this before. And we have encouraged folks to, yeah, either use that credit card to pull it off after the payment has been made, so credit cards aren't on file and some other information there. But definitely leaning on the providers if you have any ideas on that and want to provide some input.
I see Kevin wrote, I usually encourage my clients to grant access to payment portals. Emily wrote, we haven't had any luck and have had several of our members marked as fraud and accounts closed because of it. Kathy writes, they require a card always on file. We have put a card on file with zero balance, then paid when authorized with our corporate card. Spectrum is difficult. And it works for Kathy. Thanks everyone who's sharing. All right, I'm going to move us to another question. And this one is about training that are required for outreach and engagement services. So Kelly is seeking clarification about required trainings for HRSN provider staff who are focused on outreach and engagement. We have reviewed the training webpage, which currently contains recordings of past office hours. They're informational. Okay, our CCO states we need to have written documentation of completed provider trainings, but they do not offer trainings. Could you please advise whether OHA has established specific required trainings for outreach and engagement HRSN provider staff? Teresa.
Hey there, thanks for this. So, regarding HRSN O&E provider trainings, we do have a lot of informational trainings on and modules, I think that we usually call them, on the training website. So I'm really glad that you found those. There's a lot of question and answer opportunities as well, and work sessions. And I can see the confusion with written documentation of these trainings. The coordinated care organizations that you contracted with, whether you are contracted with, they are responsible for providing provider trainings and directing you to trainings. So the best I can do on required trainings, which would be things like cultural competency and trauma-informed care for outreach and engagement, you can absolutely go to resources like Trauma Informed Oregon and take trainings there. That's always wise or always available to you. But the coordinated care organization may have specific requirements for their provider networks for training. So unfortunately, I do have to send you directly back to your coordinated care organization as well. Please email the program email that we'll have in the chat for HRSN if you'd like to follow up directly on your situation, though. Actually, I feel like you might have. So if you want to re-email us, that you are very happy to, you're welcome to, because I have seen an email come through. I'll make sure we answer it as well.
Thanks, Teresa. All right, I think I have a couple questions in here about utilities. So I'm going to start with a question from Megan. Can you please review the utility guidance section on pages 19 and 20 of the OAR? My CCO is interpreting this as we cannot pay a utility bill if the member or member's guardian is not listed on the bill. When I read further, there is a list of documents that we can use to corroborate that the member lives at the same residence when they are not on the utility bill. Please advise. Who wants to take this one?
And can we actually talk about utilities in general here? We have a couple. So looking at utility, that question, we also have another one that's really similar from Edgar. Tanya, if you do you want me to read that one too, or would you like to read it? We could answer them both together.
Yeah, I'll read it out and then let you answer it. This question is from Edgar, and it says, hello, I had a question regarding utility bills. Under new guidance, we have been instructed that the bill has to be in the member's name that applied for the benefit. In the OARs, there's a section where it mentions if the bill is not under the member's name, there can be a document submitted to verify the address. Just wanted to clarify if that is acceptable or if it has to be under the member's name no matter what. All right, take it away.
Okay, we'll go ahead and start. Okay. We have some information in rule that I wanted to pull up. You will need to corroborate that the member lives at the same residence. Yes. Um, we will go to, hold on one second. We will go to the rule and get that for you. Apologies, more tech issues. Let's go back to the Medicaid household size question quickly, Tanya. Sorry about that. And let's move to that one quickly. We have an answer on that.
Okay, great. Thanks. Let me see if I could pull up the question again as a refresher. The question was, how can we as providers confirm who is in the Medicaid household?
Thanks. So on this one, as providers, if you have access to a CCO portal, there may be information in there, so the coordinated care organizations. But essentially, you'll lean on the member and help gather this information. We do have some information on exactly what household size means that Sarah presented, and there's also guidance online as well. We'll send that link to you. And that is it's called the At Risk of Homelessness Income Verification. So it goes through how to look at household size. The Coordinated Care Organization or Open Card are responsible for verifying the household size. So as you send this information in on behalf of the member, it may not be exact. And so the health plan should look at that and make sure that they have the information and they can verify and communicate with the member on that. Unfortunately, we don't have a system because the Oregon Health Plan is essentially set up as generally an individual benefit. We don't have that entire household set up in a public facing portal or anything. So does that help? I think it was someone earlier in the chat.
I think it was Natasha.
Natasha. I knew it was a name like that. If you have any follow-up questions, please let me know. Oops, I went unmuted there. If you have any follow-up questions, please let us know.
All right. It doesn't look like it. And I think you might need to double check on the utility questions, right? And wait a sec so we can try another question in the meantime. All right, let's talk about some privacy concerns with potential data sharing. The question is, I'm concerned about the potential data sharing of OHP members that are undocumented with ICE. It's my understanding that HRSN is matched with federal dollars, and receiving assistance could put undocumented OHP recipients at risk. Can you give us guidance?
Hi, Megan. Thank you so much for this question. And we've actually had other folks ask it, so I'm sure there are more people in the room as well that have this question. So first of all, I want to just say that I think that there's always a chance for data being shared. There has been chance of data being shared because people that are on the Oregon Health Plan, if they have access to any emergency services, regardless of what population they're in or what benefits they have, it is reported to the Centers for Medicare and Medicaid Services. So just to be really clear on that, there are some laws and rules and lawsuits that have happened at the federal level about sharing data, and particularly relating to this specific question on ICE, whether immigration status is shared. So I don't have the perfect answer right now. I will tell you that there is guidance on the OHA website that will be updated very soon with additional guidance and additional information that have come out from policy changes and from some court decisions in early January. I think the best thing for now is for us, as soon as that resource is publicly available, so you have all the facts right in front of you and can link it to some written documentation from OHA, that the best thing would be for us to send this out to this entire group, I think, as a follow-up. So we will absolutely do that. I just wanted to make sure and answer this live and let you know that the Oregon Health Authority is working on this, is working on communications with members, with providers, et cetera. So thank you for the question.
Do you have a timeline on when those documents will be published and available?
Like now is the hope. So the hope, and I can't make any promises, of course, everyone understands that, but as soon as possible. So not months, hopefully not weeks, hopefully very soon. So, but again, going through different levels, or not again, I didn't say it, but going through different levels of review and making sure we have all the facts does take some time. So, but those are far along in the process and should be posted soon. Thank you, Megan.
Yeah, can I follow up, please?
Of course.
There have there been any changes since, was it January 7th or 14th? I can't remember, when it was determined that's legal for CMS to share data like addresses and immigration status with ICE?
Not that I'm aware of, but I'm not sure. I'll have to lean on our external relations division to answer that. I will say that I do know the January 6th court decision, yes, allowed CMS to receive data for those lawfully residing in the United States. So in quotes, that's what it was. And I say in quotes just to be really specific because that's how I've seen it presented. So more information on that will be coming. So thank you.
And you said unlawfully residing, is that correct?
Lawfully residing. I'll put in the chat the actual language there.
Yeah, please do. Please do. It's my understanding of it's the opposite, where they can send data for folks who are unlawfully residing, so they don't have lawful immigration status.
Yeah, let me pull that language and actually get it into the chat for you.
Okay, thanks. Yeah, I've asked, and I went to an OHA meeting about it, and I don't have talking points or guidance to share with my team on what conversations we should be having. I don't want to discourage people from accessing assistance, especially emergency medical care, but we need to give this information to people who will be impacted.
Absolutely understood. Thank you.
Hi, this is Jake Kelly. I'm with OHA. I just wanted to opine a bit further here. I think this conversation is directly applicable to data sharing as it relates to OHP in general, or rather Healthier Oregon, the portion of the benefit that caters to undocumented or non, you're eligible for Medicaid, but for immigration status, and you're enrolled with Healthier Oregon. I think it's that conversation specifically. I think it's worth noting that HRSN does not. I think we can confidently say that HRSN does accessing HRSN services does not put these populations at enhanced risk in any capacity. To your comment in the Q&A, Megan, HRSN is fully state funded for Healthier Oregon members. We don't draw down federal funds. We keep a very clear distinction. So on that front, that doesn't negate or take away from the very real data sharing concerns that OHA is navigating. That is, we're trying to fight essentially what's happening at the federal level, but just wanted to make that distinction. Like, especially if folks are already on OHP or healthier Oregon, I don't think it's like we can confidently say that accessing HRSN does not create additional data sharing concerns. I would love if anybody on OHA side feels that that's not a correct statement.
No, I think it is that HRSN absolutely doesn't put you at more risk with that. Absolutely.
Thanks, Teresa.
That's really good to know. I got that from a list of services that are matched with federal dollars. So I wonder if that's just outdated. I'll send you guys that link because that's where I found that info.
Yeah, the HRSN, there is, so
No,
people that are on the
we
Oregon
do,
Health Plan,
services are federally matched, just we make a distinction at a member level where we're drawing funds from, and it is reliant on what benefit package or specific category of aid that a particular member is enrolled under. Like I don't need to get into the technicalities of like Affordable Care Act, income bracket draws down a specific federal match, but we have back end systems that identify what population a member belongs to, and then the so for Healthy Oregon members specifically, whenever a claim goes out, there's a back end process that attributes the costs for those services, and that which we are paying CCOs per monthly amounts to like do broad care coordination for these members. Like all of those funds are state fund only. But if there's a resource that's confusing, please do share and we can absolutely get something corrected.
Yeah. I just sent it over to the two of you. Thank you for clarifying, Jake and Krista.
thank you. Thank you so much. Thanks for bearing with us as well. We're gathering some more information about that, and we'll put that in the chat as well. I think we're ready to go back to the utilities questions, Tanya. Thanks everyone for bearing with us.
Yes, thank you. And thanks for the important conversation on that. We'll definitely follow up with resources as soon as we can. Going back to utilities, there were two questions in the chat that I will just reread as a refresher. Can you please review the utility guidance section on pages 19 to 20 of the OAR? My CCO is interpreting this as we cannot pay a utility bill if the member or member's guardian is not listed on the bill. When I read further, there's a list of documents that we can use to corroborate that the member lives at the same residence when they are not on the utility bill. Please advise. And the second question, similarly, says, under new guidance, we have been instructed that the bill has to be in the member's name that applied for the benefit. In the OARs, there is a section where it mentions if the bill is not under the member's name, there can be a document submitted to verify the address. Just wanted to clarify if that is acceptable or if it has to be under the member's name no matter what. And I am going to hand that one to Jesse, if you could help us out, please.
Thanks, Tanya. Yeah, thanks for the questions. So the utility bill does not necessarily need to be in the member's name who's receiving the benefit. And as you noted in OAR, there are some flexibilities. Essentially, in these situations, we just need some sort of way to connect that utility bill, for which the member's name is not included, is connected to the address to where the member lives. And so you'll see in the OAR, and we can put the link in the chat, there are a variety of ways that can be connected. So there's a list of different documents or pathways to verify that that utility bill is connected to that residence. So you're absolutely right. There is some flexibility there. It should not be an outright denial simply because the member's name's not on the utility bill if there's a way to make that connection. Does that answer the question, or do we need to dig into that a bit deeper?
I think that answers the question. This is Megan here. It seems that my TCO Pacific source was interpreting the guidance that you can use a document from that list if there's no one's name on the bill. And then if they were telling us that the member had to get their name put on the bill if they wanted help with the utility. But what I'm hearing from you, Jesse, is that's not the case. If someone else living at the address is on the bill, member's not, it's okay.
Yep, as long as there can be some sort of verification or documentation to support that. And I think it's in table, we can put it in the rule, but I think what the citation that you listed is correct. It's table 5, and it's section K. So section K in table 5 talks about that scenario if the member or the member's representative's name is not on the utility bill, they can submit additional documentation to support that.
Right. So that's great.
Yeah, let us know if we need to follow up additionally on that. These kind of things are really good for us to put in our CCO work session as reminders. Like when we hear, maybe some confusion on policy from you all, we can be sure to carry that forward to our work session as a reminder.
Yeah, I'm not sure what happened because we were informed that change went into effect, I think, beginning of December. I was out of the office, so I don't quite remember, but they had told me to reach out to OHA. So Jesse, I think I'll just CC you in an email to Pacific Source, if that's all right.
Yeah, that sounds great.
Okay. Thank you.
Thank you as well for answering the question. We appreciate it.
You're welcome. Thanks for the question.
Thank you both. All right, I'm going to move us to a CCBF question from Stephanie. The question reads, if we use CCBF to fund staff members for 30 hours a week each for the life of the grant, can we use additional CCBF funding to fund 10 hours for those same staff members going forward, or are we limited to 18 months of funding for a staff member regardless of hours? Jesse?
Yeah, I can take that one. So there is some flexibility there. It's 18 months of a full-time equivalent. So that can be divided amongst a longer time frame, as you've indicated you're doing. So it's 18 months of a full-time equivalent. So it doesn't have to just be the 18 months if you have allocated less than a full FTE during that time frame. So I actually have an FAQ we can put in the chat that has an example of how providers may be doing this, like with 0.25 FTE, spreading that out over 72 months, a half FTE over 36 months, and so forth. So I'll put that in the chat.
Thank you, Jesse. Okay, I'm going to ask a question about OpenCard. This is from Kevin. I would like to know how I can get a non-native switch to OpenCard when their CCO has kept them waiting for 6 months from approval and there's still no provider for him. Charissa.
Hey, Kevin, thank you for that question. I want to talk a little bit about the wait time, and that is quite the struggle. If you have any, if you would like to, or the member would like to reach out to our ombuds team for a long wait like that, that would be the best thing in that situation from an HRSN perspective. And we'll also put the ombudsman information in the chat. As far as switching to OpenCard, I don't have a specific answer for that unless anyone has other information. I think calling our customer services unit, asking the member to call the customer services unit rather, would be the best place. We'll also put that information in the chat for you, but then they will be able to go over that individual's options with them and determine how best to move forward for the member, or the member can decide. So thank you for that question. If you have any specifics that you want to email HRSN program, you always can do that, of course.
Absolutely. Thank you.
Yeah, thank you.
Thank you, Charissa. And I would agree with those as good next steps for both of those. Question about payment per member per month from Mohammed. Is the payment model of per member per month only for CCOs? And from my understanding, the reimbursement fee hasn't changed in the latest updated fee schedule. Is there a way providers can change the reimbursement fee from per 15-minute units to the per member per month model?
Yeah, I can take that one, Tanya. So to the first question, the model is at present only available for CCO or provider servicing CCO members. Um, the the PMPM model needs to be something that's agreed upon slash approved by the CCO. And so if that's something you're interested in and you're working with CCO members, definitely want to talk to your CCO about changing the payment model. I'll note that um, I'll be forthcoming and note that CCOs have, from our perspective, have generally been reluctant to switch to this payment model, understanding that there's several or various limitate not so much limitations, but like requirements, documentation requirements, minimum um, time slash engagement with a particular member that would justify the PMPM model. Um, there's more information, I believe, on the PMPM model in our guidance document. I think that's a good resource to check if you're doing all of those things. Um, and I would please suggest if that's something you're interested in and you're also having difficulties like bridging that gap with the CCO, let us know, and that's helpful and informative about how we might be able to change or revise our guidance to better support the PMPM option. I think the last thing I'll note is that I think critically why, or another reason why we haven't seen a lot of uptake of the PMPM model across ECOs is because um, the perfect, sorry, I'm gathering my thoughts here. The PMPM model can only be like used can only be used if the like a single housing tenancy provider is providing all related tenancy services. Um, and we see in some CCOs that there's a provider who's approving payments, and another provider who's doing more hands-on case management. And in those situations, the PMPM model wouldn't work as seamlessly because there's multiple providers doing the per 15-minute work and they're billing the per 15-minute work. So in those situations, that's where that model probably works better. Is that helpful?
Yeah, that's really helpful. If I might add, will OHA consider doing that model for open card members, or is it just strictly for CCOs?
We can take that back. I can't
Okay.
immediately um, opine on the like where how that landed. I mean, I think there's an element to which um, the CCO has a yeah. I will stop the ramble.
No,
We'll
no, you're completely
take
fine.
that back.
Honestly,
I
it's better
appreciate the
information.
input.
One other thing, is there any resources that OHA may have for small providers? We're in the Portland metro area. We tried every single way to contract with the CCOs in our area, but each way has got us nowhere. So we've just been stuck with serving open card members. Is there any resources for small providers that, agencies or organizations that help small providers with, running to roadblocks like this?
May I phone a friend?
Yeah, I'll jump in. Thanks for the question. So I will clarify it is the CCO's discretion on how they build their networks.
Hmm.
But I think we would be happy to meet with you and kind of understand what potential barriers there may be to this networking, because I know that CCOs have provided sort of this readiness assessment process that they vet providers before bringing them into the network. And so I would be curious if there's been any feedback that you've received and kind of what areas. Okay.
Unfortunately not. We try to understand the reason why we weren't selected, but it's just been a copy and paste email. So we couldn't get a hold of anybody, and then we just kind of gave up because there was nothing to do from there. Um, but hopefully in the next round of contracting process, we have better luck.
Okay, we're happy to meet with you and
Mhm.
hear about the experience. Again, it is the CCO's discretion to to build their networks, but I would still be interested to hear kind of about the specifics, the population that you're serving, the services you're providing, and understanding potential barriers. Yeah,
All right. Yeah. I'll shoot
okay,
my email in the chat if that helps.
great.
Perfect. Thank you, guys.
Thank you for the question. And Kevin, did you have anything to add to this question? I think I see a comment from you wanting to add.
Well, I can just say that, I've experienced some similar situations to you, and I had to find alternative ways of of finding members that are in need. And I reached out to some tribal housing organizations, and I get direct referrals from them. So when a CCO is, not responding in time, taking them 6 months to get someone to find a provider, I can just call with that member and get them switched over to open card because they're native and they have that right. So that's what I've been doing, and it's helped my business a lot.
Yeah, and that's what we've been doing also. We connected to powwow events,
Yeah.
diving into the Native or American indigenous community. That's the only way that we can serve open card members. But there's a limit that where we can exceed that. It's not like, where CCOs have served more than 600,000 members, I think, right now. We're the biggest CCO in our area.
Yeah.
But yeah, we were just trying to open our network to CCOs and more than that. But yeah, that's really helpful. That's what we've been doing. It's working great for now.
Yeah, it's I don't know, I can't say why their network is so restrictive, and why it's so hard to get into, but yet it's taken 6 months to find a provider, but yet they're saying our network is fine, we don't need you. But
Yeah.
I
I have members calling,
I have a
saying they
letter,
want.
from someone who's seeking my help, who was approved in August. They said you're approved for 6 months of rental assistance and utility assistance. We have to find you a provider, and he's been evicted since then.
Yeah. Yeah. I had similar issues with that too, but unfortunately, we can't really do much.
No, just you got to keep reporting it though, because it's the metrics. If
Yeah.
they're reporting metrics that are not accurate, then that's something that needs to be talked about.
Yeah, I appreciate this conversation. It is helpful. And we would like to follow up further with both of you to really understand again the services being provided, the population you're serving, and I think maybe taking a look at the specifics of service delivery. And it sounds like you don't really understand or have not received feedback on the why and what barriers there would be. So I think digging into that would be helpful for us.
Yeah, the feedback that I've gotten from, I'll just say one CCO that I've continuously butted heads with because I served a lot of their members and I couldn't get reimbursed. And it was simply because I'm not contracted, but yet I can't be contracted because I'm not a licensed provider. But that under HRSN rules, that is, you don't have to be a licensed provider. I'm not a licensed therapist, but nor are most HRSN service providers. So they encourage community-based organizations to become providers, and that's what we are. But yet they're telling me they can't reimburse me for my services because I'm not contracted, and the reason I can't get contracted is because I'm not licensed. And it's just it's the same repetitive information that I get regurgitated to me every time. So it's like, it's a rule that the CCOs like to seems like they like to stick to because it gives them the easiest way to deny entrance into the network.
Kevin, could we perhaps have a follow-up conversation on the licensure requirement you're referencing? I'd like to hear more about that specifically.
Sure.
Great.
All right. Thank you both for the conversation on that. I do want to give a quick reminder to folks, if you wouldn't mind submitting your questions in the Q&A box rather than the chat. It helps us stay a little bit more organized. All righty. I'm going to move us along to a different topic. This is a question from Jacqueline about modem leases. I'll read out the question. It says, okay, per the verbiage in the OARs for devices, it specifies purchase of devices. I spoke to an internet company and it is not to purchase a modem, but to lease a modem during service. Since they are not purchasing a modem, is this a service we can continue to add to the covered cost? Can that be added to OARs, or does the language currently used cover that? And I'll hand that over to Jesse.
Thanks. That's a great question. So in the OARs, we say that we cover internet as a utility, and this seems to be included in what the internet fee would be. If you've received clarification, it's not purchasing a new device, and it's really inclusive of that monthly internet or however, whatever the cadence of that bill is, then that would make sense to pay the utility.
Thank you, Jesse.
So I just wanted to clarify and make sure that then it sounds like the current language of purchase a device is already making that statement, so that when I bring this back to my CCO, that we can support that with that already existing OAR language.
Yeah, I think it supports it for sure. But
Perfect.
if you run into any barriers there, feel free to reach out and we can support.
Awesome. Thank you so much.
All right, thank you. All right, another question in the Q&A box. This one is around O&E and nutrition service providers. I'll read out the question. It says, there was guidance shared from our CCO partners in December that it is recommended that nutrition service providers also become outreach and engagement providers to be able to bill for outreach and engagement services. Is becoming an O&E provider also recommended for open card HRSN nutrition providers? How do O&E services differ from the activities under program cost and delivery portion of the fee schedule for both models of the fruit and veggie benefit and Pacific Source benefit? Teresa, maybe?
Yeah, that's me. Hey, Claire, thanks for the question. This is quite a question, so it's going to take me a few minutes to answer all of them. So we'll go ahead and start from the top. We have nutrition services, pantry stocking, and fruit and vegetable benefits that are scheduled to go live in June of 2026 this year. We have HRSN service providers that are starting to sign up with their coordinated care organizations and Accentra Open Card, of course. So now we go to outreach and engagement. So what is outreach and engagement? How does it relate to nutrition services? So we do encourage our nutrition services providers. Well, we encourage all of our providers to sign up for HRSN outreach and engagement as a specialty, even if it's not their primary service. So if they mostly provide rent and utility assistance services, if they do provide some outreach and engagement, we always encourage people to enroll. The activities that are billable under outreach and engagement include linking people to HRSN services. It includes helping people with their renewal paperwork for the Oregon Health Plan, not their application because they already have to be an Oregon Health Plan member, but renewal and connecting them to resources like primary care, social services, education, legal aid. So it's this navigation, not quite case management, but navigation benefit. So coming directly to the nutrition services, outreach and engagement could potentially fill some gaps around program costs and delivery. We have some guidance that we're working on here to provide service providers and health plans with some specific information on that. And we'll come back with more, but essentially it could potentially cover gaps that service providers are helping members in a deeper way or with additional services like providing resources beyond the pantry stocking and fruit and vegetable benefit. So I think the best thing is to say there is opportunity there, and we really want to invest in our HRSN service providers that are doing the work to help our members. And so we definitely encourage that benefit. It's one of the keystones of health-related social needs in general. Let's see. I wanted to go back. I thought there was a more specific question and I lost it. So let me find the question again. Sorry, everyone. Sorry, Claire. Let's see. Okay. Making sure. Yes, it is recommended for open card nutrition providers as well. And more guidance to come on the activities under program cost and delivery and outreach and engagement. That's worked on. It's being working on right now. So I think I answered your questions. Claire, do you have anything else? It was a big question, so.
It was a big question. Thank you for your detailed answer. Yeah, I think that the main, I guess, concern or like overlap is in the program cost and delivery, the customer service like specific statement in that. Like how does that differ, or can it overlap if a service provider is, of course, in many months going to be billing for both outreach and engagement for a member, or helping them with that fruit and vegetable, let's say, navigation, or if they're providing customer service underneath the fruit and vegetable like billable service underneath the program cost and delivery part of that. So just wanting some like very specific language about those two things, which of course I'm sure is forthcoming and you're thinking about. So thank you.
Yep. That is absolutely, we'll need to delineate all of that to provide good guidance. We do need to ensure that there's no duplication of services, there's no supplantation of services. So there will be some really specific examples, scenarios, and guidance coming out on that. Thanks for bringing it up. We have the last question here. Oh, Tanya, I'm not the facilitator. This one was specific to the utility bills, having the name on it as well. I thought maybe we would answer that one.
Go for it, Teresa.
Actually, I believe the discussion was that there is flexibility, and we want to refer you to the 410120-2005 HRSN Oregon Administrative Rule. Take a look at that because there is flexibility in certain situations. We actually have updated that OER to reflect that. So we'll make sure and get you that link as well. Thanks. I think that's all in the Q&A for now, Tanya.
Oh, it is. But I do want to, oh, hold on one second. It disappeared on me. Okay, there was a comment that said, I hate to be negative at these meetings because in all my experience as a provider has been life-changing for me and the clients that I serve. And I just want to acknowledge that we welcome your questions. And I know sometimes things are hard and we try our best to give you answers, and your on-the-ground work can be challenging, but I just want to acknowledge that we really appreciate all the work that you are doing to support our members. And we know it's really challenging. So we hope to make this a space where you can feel comfortable asking those hard questions and that we can continue to learn and improve from your experiences. So no need to ever apologize. We appreciate all of you and the work that you're doing.
Thank you.
All right.
Appreciate that.
Yeah. Thanks, Kevin. All right. I won't be too sappy. Let's go to another question. Let me see as we're looking through the chat. Teresa, what are your thoughts on the order of questions we answer next?
There, yeah, let's just answer both of those live, and I don't think we'll just start with Logan's question.
All right, I will read this out. How does OHA anticipate auditing the 2026 OAR requirements related to documentation of medical information from the past 12 months, including what tools or data sources will be used for the audit? Will audits be conducted directly by OHA or through CCOs? And if audits are primarily CCO-led, what documentation standards or requirements should service providers anticipate so we can proactively align our archiving and retention processes?
Okay, I probably could have answered this in writing because the answer is we'll have to do some digging around at the Oregon Health Authority, unless there's someone on the call that can answer specifics about auditing, etc. I probably can't answer that here in this meeting, so thank you. We will follow up though.
Thank you, Teresa. Question from Leslie. It may be too early to ask, but will there be a discussion for plans when the demonstration sunsets?
So this is another one where it's sort of a non-answer, so I apologize. But yes, the answer is yes, but we don't have, we are anticipating renewing the waiver, and we are going to the Centers for Medicare and Medicaid Services with this renewal application for our current waiver services. There's going to be some more information coming out around that, certainly in community engagement as well. But at current time, there's no plans to sunset the HRSN program. So when or if and when, hopefully if that happens, we will absolutely have a plan and have community engagement and be discussing it with you here. Absolutely. Just for anyone else that may not be as familiar, what we're referencing is that the Health Related Social Needs Services Program is under the 1115 waiver with the federal government. That means that the Oregon Health Authority asked to do these additional or special programs to see if they would impact member health outcomes positively and how they would impact. And so as we move forward, the end date of this waiver is September 30th of 2027. Technically, they run on a 5 and then a 10-year cycle. So the first 5 years is implementing the services, and then hopefully we will have it for the next 5 years where we can evaluate and make improvements, etc. So again, more to come on that. Thank you for the question, though. It's very important.
Thank you so much, Teresa, for answering that. I see one more question in the chat, and this one is about, well, I'll just read it. If someone is in their final month of assistance, but during the 5th month they became nervous for some reason that the rent would not be paid on time and paid the 5th month themselves in addition to their assistance, resulting in a 1-month credit, are they still eligible for the 6th month of assistance?
Hi, Tyler. This is a little bit case specific. So I'm going to answer in 2 different ways. The first one is per rule, I want to be really clear. HRSN rent and utility assistance does have to be provided consecutively, except for rental arrears potentially. So any forward rent does have to be month 1 through 6 or month 1 through 4, etc. But there's a caveat, of course, because we usually have some of that here. And that is if the landlord is willing to move that credit to the 7th month, if they can put that on their ledger, and the health plan or the HRSN service provider continues to pay for and puts dates of service for months 1 through 6, that is possible. So understandably, members can get a little nervous. It's their life, it's their home, it's their life. And so I do think working with the landlord and making sure that it's credited to a later month and still having HRSN pay for that solid 6 months consecutively would be ideal.
Thank you, Teresa. And Jacqueline, I see your hand. Go ahead.
So I would like to add to that a little bit and ask a different clarifying question regarding utilities. So if a member with that consecutive 6 months has, say, 3 utilities that we're paying, and for some reason we didn't get a bill for November, but we presumed that we would get one when it came forward. So we went ahead and paid December. But say, for instance, the November bill never comes because they did decide to start paying it or an energy assistance program kicked in. It would then not be considered consecutive, that December payment, but that would have been just on the assumption that we had received consecutive bills prior. So we assumed we would, and instead of waiting for those prior bills to come forward, we went ahead and paid a December bill. How would that work as far as consecutive payments goes, and would that still be considered appropriate to have paid that bill than waiting maybe a month for prior bills to come forward? Does that make sense?
Yes, it does. We actually have had a situation come up like that. I think on this one, I'd like to provide some really detailed information. We had scenarios as well. It's going to take a little bit for us to gather. Can we follow up with you on email with that one,
Yes.
Jacqueline? Is that
Yeah,
okay?
absolutely. I'll go ahead
Unless,
and put my email in the chat.
great, thank you. Unless anyone else wants to verbalize that answer, but it's not easily coming to the front of my brain. And I do think there are some details there that we would want to share with you that would be helpful.
Awesome. Thank you.
And first question though is great, Kimberly. We can follow up then with the entire group. Do you want to make the question? The rent utility, I mean, I'm sorry, the rent financial assistance payments are consecutive though,
Yes, yeah,
right?
the rent is
Yeah.
consecutive. It just so happens that, like I said, they've got three different bills that come out at different times. And so while we waited for previous bills to come forward, we went ahead assuming that again that the rest of the bills would be consecutive like they had been. But we just and usually we reach back out and say, "Hey, can we get that November bill or one of your November bills?" But just in the case that we don't receive that, what happens because we paid their December bill? So I just am just curious about that.
Yeah,
Because when there's
absolutely.
multiple bills at play, it makes it a little bit harder because you want to be able to pay bills on time and make sure they don't incur any late fees and they all come out at different times. And so with all of those nuances, that can just be something that might happen for folks. And so I just was curious about some clarity around that.
Okay, thank you so much.
Yeah,
Yeah, we'll follow up. We have a couple, I see another email in the chat as well. So we'll follow up with you, Jacqueline. And I
awesome.
think we
Thank you.
have your email already, Jacqueline. So
Okay, perfect. I won't put it in the chat then.
thank you so much.
Beautiful.
All right, so it sounds like we're following up on this one. And I do want to pause for a second, see if anyone else from the HRSN team wants to add anything verbally, though I know we're doing a written response. Okay, I think we're good on that one for now. I don't see any questions in the chat, and I don't want to make y'all stay any longer than needed. So I will make a last call for questions before I go into my whole wrap-up spiel. But any final questions from folks? All right, I'll read this one from Savannah. With regards to asking the landlord to credit any rent that the tenant pays during the 6 consecutive months of HRSN assistance, we have been told by our CCO that we can't make any payments if there is a credit on the client's account. Can you clarify?
Apologies. I'm thinking through that one as well.
I've actually had this experience once already
Do
with a,
do you want to speak to it at all, Kevin?
with a member who had a credit. They had a credit when I started, so it was so I started with the 6 months of the payments, and then then they use that credit at the end. So I mean, as far as I know, like if a person has a credit, you could still provide the service, you know. So like basically when I paid the rent, the person had just paid their rent already. And so they had a credit, but I still paid that first month as soon as they got approved. And so then they just tacked it onto the back end.
Yep, we've had that up a couple times. We've had that come up a couple times, Kevin, and you might have been one of the examples I was referring to. Um, Savannah, will you email HRSN or Jesse? I see you coming on, and you always have great advice. Can you help?
Oh, this setting expectations high, sure set. I, yeah, we have some guidance to our CCOs in the FAQ on how to address this. I was going to pull that up, but our ask is in this scenario that the CCO and the providers work with the property manager and see if that balance can be used for a following month that's not in that 6 month period. And Kevin, it sounds like that was what was happening in your situation where they applied it to a later month. And that's our ask as well, so that the member can retain the 6 month benefit.
That's exactly what happened. Yeah.
Okay. Yeah, I'm guessing it varies based on property manager, but we do have some FAQs and talking points on that we can share, and we can reiterate that with the CCO to see if there's any additional guidance or nuance to that situation. But essentially, we're trying to provide the flexibility, but know that there may be some roadblocks there with what property managers are willing to do. But assuming that they would want to because they're getting the payment, right? Any additional thoughts or follow-up questions on that?
Yeah, we hadn't gone to the property managers or the landlords with the question because we kind of got the blanket statement from our CCO that if a client has paid, there's nothing we can do to use the HRSN benefit for that month, as if there's no like outstanding balance, basically. So that's good to know that we can push back on that.
Yeah. Oh, sorry, go ahead.
Sorry, I had a situation that just came up, maybe that I would like to ask about. I had a client that just got approved for 6 months utility and rent assistance, but because of something in his insurance, it wouldn't be approved for the rental arrears. For some reason, he was not approved for the arrears, and that's where he owes the most money. So he's still in the process of being evicted, even though he's been approved, because he still cannot pay. It's like $8,000 in arrears that he was not approved for. He was approved for 6 months going forward, but not for the arrears. And it was like some technicality that they couldn't pay the arrears. And so we're trying to figure out that situation right now. Like could he carry his approval since it's never been used to a new address now if he has to get a new place?
So if he moves to a new address, that would likely need to result in a new request, a new application. I'm not sure that
Yeah, so he could still be approved for the benefit again then,
Right,
since he didn't
right.
use it. Okay.
Yep.
Yeah.
Probably need to definitely need to reapply with in getting the new lease in documentation. But yeah, if the 6 months benefit has not been used previously and they relocate to another address, they can certainly be eligible again.
Okay.
Or not again, but be eligible.
Yeah, definitely. Okay.
Okay, I'll go to Dominique and then I'm gonna transition to some comments that came up in the Q&A around this conversation. Dominique, go ahead.
Hi, so I just need a little bit more clarity. I'm actually writing this down because I don't want to beat it down, but the utility payment thing that a lot of us had questions on. I pulled up the ORS again. I'm reading it, and how it's been explained to us is kind of different. So say I pull Jane Doe out of the queue and she sends me her utility bills. All of the utility bills are in Jane Doe's husband's name. Okay. So we've been told it has to be in the member's name. So like, I get if it's a child, like that it comes under that we have to have proof that it's Jane Doe's medical bills. Obviously, it's not going to go in the child's name, but if it comes in the husband's name, the bills, I mean, I guess that's my confusion. We have to pay it only from the member's name, or does that include anyone in the house? We're very confused on this.
So it's got to be the household. It's the entire household.
So for the utility bill, the person's name does not need to be on it because there may be situations, right, where a member is living with a roommate, right, and the roommate has the utility bill in their name, but the member is paying for part of that utility. So as long as that verification can be confirmed connecting that utility with the member through the other means in rule, that would be allowable. Does that answer your question, Dominique? And is there, sounds like maybe there's some additional follow-up we can do on our health plan side to clarify that rule.
Yeah, specifically if we could follow up with Elliot at Pacific Source on that rule to kind of understand.
Yeah, absolutely. We can do that. I think I want to better understand if there is some scenario that we're not considering, but yeah, I think we can reframe the expectation around utilities. And again, from kind of like a program integrity perspective, there does need to be that connection with the utility bill and the member, but they do not have to have their name on it if that connection is verified in some other way. So we will certainly follow up on that. Team, can you help me take that action item forward?
Thank you, Jesse, and thank you, Dominique, for the question. I'm going to put a slight pause on questions for now. We have a few in the chat that I want to make sure we get through so that we're not scrambling to wrap things up. So if we don't get to questions during the session, please send an email to our HRSN inbox. But I will try to wrap up the stuff that we have in the Q&A right now. So a couple comments from Jennifer. My understanding of the OARs is that if the credit comes from a local, state, or federal funding source, that it is duplicative. My interpretation is that a credit from a personal payment is not duplicative. Is that correct? I will just add that if the considerations around credits are different for rent versus utilities, guidance would be helpful.
Thank you. Ed, I wanted to let you know that more guidance is coming on this. So I wanted to answer that live. Absolutely. If the credit comes from local, state, or federal funding source, barring situations that I can't think of right now, that would be duplicative. If we cannot, HRSN cannot pay for the same month of rent as any other service that is local, state, or federally funded. So if someone has a month of service through another, or a month of rent payments through another program, HRSN would need to be 6 months consecutive, either before or after that. Yes. So a credit on the count from a personal payment would generally have come because of a situation of where the person feels fear of not getting it paid. Maybe it's taken too long and they pay 1 month, but it was during that 6 months approval. So when they do finally get paid, that we ask to do that credit there. So for the most part, months should not be paid for through HRSN if there's another payment. But again, we understand the member situations are quite different. So I hope that helps.
Thank you, Teresa. Question from Cynthia. Is there a limit on arrears for back rent once approved?
The limit is 6 months full rental assistance. So if they apply and they have 6 months of arrears, they are eligible to be approved for that. If they have 2 months of arrears, they could get, and that's back rent, they could get 2 months back rent and 4 months forward rent. In no situation can a member get more than 6 months of rent and utility assistance. So if there were 8 months in past due or arrears rent, they would only be able to get 6 months of that.
And Teresa, just to add on to what you said, because there may be additional follow-up, it also can't be before the date of May 2024, May 1st of 2024, because that's 6 months prior to when the benefit launched, November 1st, 2024. So if it's a previous date before May, that is not eligible, and it does need to be at the member's current address as well. And yep, thanks. I see Jacqueline comment in the chat, has to fit within the monthly cap. It's important to note too. Thank you.
All right. Thank you for your help answering those questions. I think that is everything that we had in the Q&A box. Carrie, if you wouldn't mind sharing screen again, I think I'm going to wrap us up because we are almost at time. But thank you, everyone. We've had a really productive conversation today. I think that our next office hours, we have some agenda items to maybe touch a little bit more on utilities. So look forward to that conversation. And speaking of next office hours, next slide, please. Our next office hours session is March 11th. For the rest of the year, unless we need to change something last minute, 8:30 to 10 a.m., usually second week of the month. But join us March 11th. We'll send out the links to register if you don't have those already. If someone from the team wouldn't mind dropping the HRSN training webpage in the chat, that would be great. All the trainings historically are posted on that webpage. If you want to view the recording, we usually post it within a couple days along with the slide deck, and then the links to register will be there as well. Next slide, please. And we value your feedback. We want to hear how these sessions are going. If you think that we need to cover different topics, format it differently, if you changed your mind about the morning meetings and would rather have late in the afternoon meetings, let us know. Whatever you want out of these sessions, we want to hear your feedback so that we can continue to make them a useful space for you. The links are available in English and Spanish. And you can also use the QR code with your phone to access the link. I think that is, what's the next slide? Yes, all of our resources. If you wouldn't mind just going back to the survey one and hang out there for a sec. But if you navigate to the provider training page, that is in the chat. Thank you, Sarah and Teresa, for dropping those in so quickly. That should take you to all of our resources. So once again, thanks everyone for joining us today. Thank you to our team at OHA for helping answer all of these questions. It takes a team, so we appreciate everyone for working with us. Yeah. Anyways, have a good rest of your Wednesday, and we'll see you next month. Take care, everyone. Bye.